Hey everyone, we are live. It is me, Dr. Lulu, aka the Momatrician, general life coach, and parent coach. Hi, y'all. If you don't know me yet, if you're just meeting me for the first time, I am also a pediatrician, retired, semi. I'm a board certified pediatrician, retired. I'm an author of 5 books, working on my sixth. I am a former lieutenant colonel in the U.S. Air Force, former commander in the U.S. Air Force. I'm a mom of 3. I have 1 trans child and 2 regular kids for now. I am also 2-time TEDx speaker. Well, I've done one, I'm working on the second one, and just all around badass. The show is called Qweer Wednesday Wisdom, a show where I, Dr. Lulu, sometimes joined by a guest. Next week, I think I have a guest, which I'm so excited about. I come on here and I talk to you about myths, mistakes, and misconceptions that you might have heard about, that you might practice yourself about the queer community. So I'm going live on LinkedIn, on YouTube, as well as on TikTok. Hi, Cats Brew. So if you see me looking kind of weirdly, this way, that way, this way, that way, that's why, okay? The show is called Queer Wednesday Wisdom. If this is your first time, we come live on Wednesdays at 1 p.m. ish. And it's 1:14, but we are live, so you can't fault me for that. So today we're going to talk about something that's been on my mind for about a week now. And if you've been on my social media, you would have seen it. I have been talking about gender affirmative surgery, gender affirmative care. I've been trying to burst all kinds of myths. Last week, I believe we talked about, I don't know what, I can't remember, okay, I'm 53. But this week, we're talking about gender affirmative care, gender affirmative surgery, and what it really means. A lot of people don't know what it means, so I'm here to tell you what it means. Now, really quick, yesterday I was at an event, and at that event, I met a lady who is a gender affirmative care provider. I think she's a PA, and she had a question which was amazing. I like people to ask me questions. I want you to ask me first. Don't assume anything. So she asked the question. The question was, "Hi everyone, welcome on TikTok. Please stay. My name is Dr. Lulu. We're talking about gender affirmative care. I am a life coach, but I'm also a pediatrician and I'm a mom of a transgender adult. And wait, I'm also a queer person. So maybe I know a thing or two." So she had a question to ask me. She said, y'all want me to tap? Okay, y'all on TikTok, please tap on the screen so you can send me some likes so we can get more people. And yes, my like is mine, but your like is extra. But I don't mind receiving likes from y'all. So please send me some likes so we can get more people at the party. So the question she had was really interesting. She said I don't know if she's a queer person or not, but she had a 17-year-old who came to see her about the patient, in this case, was assigned female at birth and is, I guess, sharing or disclosing that they are transgender. And if you've listened to me speak, you know I don't say coming out. I don't use the phrase coming out. Okay, my next TED talk is actually about that. It's about the fact that we don't come out to anybody because we've always been who we are. We share, we disclose, we invite you in, we let you in, right? Okay, so we're not coming out because people only come out from mostly negative situations, okay? Like a bad marriage or a toxic workplace or bad relationship, poverty, depression, things like that. So for me, we don't come out as queer people. We disclose, we share, we let you in, we invite you in only after you have created a safe space for us, only after you have shown us that you are an ally and a good one at that. Okay, so we don't come out. So just note that. And if you can hear me on TikTok, please type in the comment section. Y'all don't be typing when I tell you how to type. Please type in the comment section the word not invited in, but not coming out, but invited in. Please type it in the comment section. Please type in the comment section the word Good afternoon. Jason Will, thank you so much, is saying, good afternoon to you. Educate me more about what queer consists of. Very good. So I'm all about edumacation. Okay, my ex-wife. Yes, okay, thank you. My ex-wife used to use the word edumacation as a joke. So I like it and I just stole it. So I'm all about edumacation. So Jason, you have asked and you shall receive. Voodoo child, welcome to the party. So Jason wants to go back and find out and ask very vital question. What does the word queer mean? Thank you so much, Jason. So queer, believe it or not, in today's world has been taken back from the negative connotation that it used to be. We don't use that negative word anymore. Now, queer means something good. Queer actually is a blanket or umbrella statement to represent all peoples in the LGBTQ plus community. So thank you so much, Jason. What an amazing question. And thank you for the likes. We're going to get to 1,000 likes today. Yes, we are. Okay. So keep the questions coming. I love it. So Jason, please type in the comment section, did that answer your question? Soap Factory, welcome to the party. Jason, did that answer your question? Did that help you understand a little bit better what the word queer means? In the old days before I was born, the word queer meant something negative. It was derogatory. It meant something bad. But today, all persons, or at least most persons, or persons in the LGBTQ community are reclaiming the word queer back. We don't want to call it anything negative anymore. And people like me, who am always a sucker for the underdog, I'm always trying to take up space for the underdog. I go with the word queer. I'm a queer person. I'm not bisexual. I mean, I am bisexual, but I'm not. I don't like to use the word bisexual. I like to use the word queer. Some other people who are gay want to use the word queer. Other people who are gender fluid want to use the word queer. People who are sexuality fluid want to use the word queer. So please join me every Wednesday afternoon for this show called Queer Wednesday Wisdom, where I teach you and I help you burst myths that you might have, myths, mistakes, and misconceptions about the queer community. So keep the questions coming. Jason, please let me know if this answer that I gave you did it help. Thank you for the likes. Jason is serious. Jason wants to get me to 1,000 likes today. So good. Welcome, Michael Palacios. Welcome, Lisa Lacey. Welcome, K Jam. And there was something about a lesbian earlier on. Welcome to the party. My name is Dr. Lulu. In some ways, I'm a lesbian. In other ways, I'm a bisexual. But in all ways, I am queer. Because for me, my sexuality also is fluid. Yes, and I'm claiming it. It just occurred to me that actually my sexuality is fluid. Sometimes I'm a lesbian, sometimes I'm bisexual, and sometimes I'm good old-fashioned queer. So yes. So today we're going to talk about this question that I got yesterday at a dinner where I presented. The lady is a physician assistant, and she had a 17-year-old assigned female at birth who came to see her, and apparently in the last 1 year, that patient had had breast augmentation surgery done. Okay, so just kind of focus on what I'm saying. So the patient had had breast augmentation done in about a year. But a few weeks ago, the patient came back and asked the question to her, can I start hormone replacement because I am really a man? I'm really a trans man. So the question the lady had for me yesterday was, how am I supposed to be sure that this patient is really a trans man? So I said, well, first of all, what did you think? I asked her, what did you think? And she said, well, I did not think that they were sure. I didn't think I should check off the box to allow them to have gender affirming to start hormones. So she said she told her, well, in this case, because she said her pronouns are she, her, but I'm thinking I'm going to go with him or they. Okay, so let me just tell you something really quick if you don't know. If you don't know somebody's pronouns, always default with they, them. If you don't know somebody's pronouns, always default with they, them, okay? Because that's more like queer. It's very blanket, okay? We just stop at that until the person tells you their pronoun, then you can use their own preferred pronouns. I have a couple of comments. I'm going to come back to your comments in a second. But let me just finish. So the physician assistant was concerned. She was like, well, if this patient just had breast augmentation surgery done in the last 1 year and now is coming to me and asking me to start them on, to give them the go ahead to start on hormones to transition into being a man, I was concerned, and I was like, maybe they're confused. And I was like, thank you so much. I love tough questions like that. First of all, it helps me think, right? But also it helps you think. Okay. So I asked her, because as a life coach, I don't just give you answers, I ask you the question back. So I said to her, what did you think? And so she said, well, I thought that maybe she was confused, or rather, I'm going to say maybe they were confused. And so I did not sign off. And I said, great. So, but was that confusion coming from a place of curiosity, or was it coming from a place of judgment? Because a lot of times people don't know the difference. If you ask me a question from a place of curiosity, like Jason did, I will know. If you ask me a question from a place of judgment, I will also know. So I said, chances are, if you came from a place of curiosity, that's perfect. Because we always recommend for people who want to go through gender transitioning care to get therapy big time, to make sure that you understand the ups and downs about it. So let's go to the comments and then I'll come back. So we're going to stop at that and go to the comments. Lots of comments. Thank you all so much. So Jason says, I keep on retyping. Thank you so much. And then Jason says, thank you for elaborating. Yes, thank you. It helps. I'm a straight cisgender male. Jason, you are my people. Jason, if you're still here, you are absolutely my people. The straight cis people who don't know and truly just want to ask questions because they don't know. So Jason, thank you. Journals of Transformation says, what's the harm in giving it to a woman? Giving it to a woman. Okay. I'm not sure what your question is. Please retype it. I've always wanted more hormone treatment because they look so good when they do it. Okay, so Journals of Transformation, do me a favor. Can you please elaborate? Because I think I'm only getting pieces. I want to be able to I want to be sure of what you're asking me. I don't want to assume ever, but I'm going to go off on a limb here and assume, which I don't like to do, that you're asking hormones to affirm femininity. Now, in this case, the patient told the physician assistant that they are actually male, and would like to get hormones, aka testosterone, to make them male, which is why she had the question. Well, if you just had breast augmentation about a year ago as a woman, why then do you want to get hormone replacement to become a man? So hopefully that makes sense. Cadence Brown says, you're so pretty. Thank you so much. Okay, so Journals of Transformation, thank you. I think your question is valid. The patient wasn't trying to get extra hormone for women. Why can't we get it? Yes, I think that's what you're saying. So the patient is a woman right now, but is telling the provider that they are trans male. So they were asking for hormone replacement to start the journey towards becoming a trans man, which is why the PA was a little bit confused and a little bit concerned. So hopefully that helped. Cadence Brown, please follow me. I appreciate your compliment. Thank you so much. My name is Dr. Lulu, aka the Mom Nutrition. If you're just joining me for the first time, I go live every Wednesday afternoon with the show called Qweer Wednesday Wizdom, where I answer questions like we just had from people about queer folk and I bust myths, mistakes, and misconceptions about the queer community. I am a life coach, I am a pediatrician, and I am a mom of a transgender daughter, but I'm also a queer person myself. So, this is the work that I do. Please tell other people. Please join me every Wednesday afternoon around 1 p.m. Central. I'll be here with my beautiful face talking to y'all. And Journal, thank you. You're very welcome. So, Journal says, thank you. You're very, very welcome. Hopefully, my answer helped. So, the patient was not coming for gender affirming hormones as a woman because she's already assigned female at birth. She was coming for gender affirming hormones to transition into a man. But then she just had breast augmentation about a year ago, which is what I want us to really talk about today. So that was the background story for us to now talk about what I really want to talk about today. So the myth that I want to burst today, because the show is about myths, mistakes, and misconceptions that you might have about the queer community. So the myth that I want to burst today is that of gender affirming care. And so if you can hear my voice, please type in the comment section, who do you think, and I asked this question yesterday at the event and no one got it right. But I'm sure you all today are so smart and you all are going to get it right. So who do you think is the primary or the most, who do you think is the majority when it comes to people receiving gender affirming care? Is it straight cis people or is it trans people? So I went a little further with y'all today. Yesterday says men. Thank you, but I want you to qualify what kind of men. All right, journals of transformation, I like you. Oh, I like you. So it is men, but what kind of men? So yesterday, someone else said white men, actually. Someone else said white men. And while they might be right, I don't know the race distribution, but I said no, because that's not really the answer that I was looking for. But journals of transformation, you see, I gave you some of that. Yes. But yeah, so it is not just men. If you can hear me, journals of transformation, please tell me, qualify the kind of men. So the question on the floor is, and I don't know if this thing allows me to ask questions. No? Okay, let me see. Oh, it allows me to set a poll. Very good. So I'm going to type a poll question. I didn't know I could do that. How do you do it? I don't know. Okay, so my question is, the question on the floor is, who is the majority of people who receive gender affirming surgery or gender affirming care? Focus on the fact, fantastic name, by the way, FFF, fantastic name for focus on the fact. Is that something you need to talk about, you Africans? Focus on the fact. I love your question. A lot of times, or rather in the past, when I had people come on my page and troll on my page and say negative stuff on my page, in the past, I used to block them and, kind of respond to them back negatively, but focus on the fact, while I love your name, I'm actually going to leave your name, I'm going to leave your question on there so other people can see you and the way your brain works. Okay? Focus on the fact. Since you want to come today and talk about we Africans, yes, I am proudly Nigerian, honey. Beautiful brown sugar queen. Yes, I am. And today we are talking about gender affirmative care because I'm not only a brown, beautiful queen, I'm also a physician, and not just a physician, I'm actually a pediatrician. And not just that, I'm also a queer person. And not just that, I'm also the mother of a transgender young adult. And not just that, I'm also a life coach, certified life coach, and I work with parents of queer kids. So yes, I am here. I'm taking up space and I am talking about what I'm talking about. So focus on the fact. You can focus on the answer that I gave you. You can scroll on by, or you can stay here and keep spewing out hate and showing off your ignorance. I am here for all of it. Yes. And of course, Journal, my boo over here, Journal is saying, yes, yes. I am here for all of it. So please stay. Don't go anywhere, because you know what they say, if you don't have haters, you're not doing something right. So please focus on the fact I've put your name out there. Stay a while. Hang out. Keep spewing hate and showing off your ignoramus. We are here for all of it. But anyway, oh, I love it. I love it. Please stay. So as we were saying, today we're going to talk about gender affirmative care and who really gets it. So we had Journals of Transformation give us an answer. They said men. The truth is, I don't know whether it's men or women, but I know it is cisgendered people. So I say that because most people do not realize that plastic surgery is actually gender affirmative surgery. Most people don't know that, but plastic surgery is actually gender affirmative surgery. Yes. If I get my nose done to make it straighter and whatever, less wide or whatever, to make me feel pretty and beautiful as a woman, that is gender affirming. Yes. If I get a breast job done for focus on the fact to bury their head in it, if I did that, believe it or not, that is gender affirming surgery. If I had a butt lift done, that is gender affirmative surgery. So many people don't know what really truly gender affirmative surgery is. Pierce Discord Kitten, I love your name. Thank you so much for the likes. Okay, most people don't know that the majority of people who actually get gender affirming care are not transgender people. So it's only hateful people like our friend Focus on the Fact here that actually go out there and put this mess out there and try to make it look like, oh, transgender people, or first of all, like gender affirming care is new, or that hormone replacement is new. As a menopausal woman, I'm taking estrogens right now. That's hormone replacement. But I'm cisgendered, honey. Does that make sense? If a man has low testosterone levels and has to take testosterone to get his groove on, that is gender affirming care. He doesn't have to be transgender to do that. If a man has gynecomastia, which means enlarged boobs, and wants to have that taken out or reduced or surgery done on it, that is gender affirmative care. He doesn't have to be transgender to do that. So many people don't know that a lot of things that we take for granted, that we don't know, a mommy makeover, that is gender affirmative care. So I want to come here today and burst the myth that gender affirmative care is only for transgender people. So if you don't know yet, my name is Dr. Lulu, aka the Momatrician. I'm a physician, I'm a mom, I'm a life coach, and I'm outspoken, honey, and opinionated. So yes, if you'd like to hear more of that, join me every single Wednesday. I'll be here about 1 p.m.-ish Central talking about this. I go live on my LinkedIn page. I go live on my I go live on LinkedIn. I go live on YouTube. Sorry, I can't remember. On YouTube, I go live on TikTok, and I also share this on my Facebook. So yes, and if you have any questions, type them in the comment section. Okay. So before we go, I wanted to give you some homework, because what's a class without homework? So the next time you see someone who has had plastic surgery, who has had any kind of surgery that is not transgender, I want you to engage them in a conversation. Find out from them why they decided to do the surgery. Come from a place of curiosity, not a place of judgment. Get into their minds. Get used to the fact that gender affirmative surgery is not something bad. I have had gender affirming surgery. Yes, I'm 53 years old. You think these babies are perky like this because I didn't do what I had to do, honey? I had gender affirming surgery. I had my babies lifted up. Yes, I did because I can. That is gender affirmative surgery. So, before we leave, thank you so much for joining. I'm going to try to call all the names out. Journals of Transformation, thank you so much for joining. Jason, thank you so much for joining. Art Fox 66, thank you so much for joining me. Cadence Brown, thank you for the compliment. Amazing, amazing, amazing. So I only give shout outs to people who make comments because I can see your name. But that's it for today. So today we're busting myths about gender affirming care and gender affirming surgery, and the fact that gender affirming surgery is not only for those who are transgender and is actually mostly experienced and enjoyed, if I might add, by people who are cisgendered. And we gave you some examples and we left the hateful comments on TikTok so people can see it. So you can see that nothing you say can break my back because I have a reason and every right to be here. All right. On that note, I will see you all next week. Remember to follow me on social media at Dr. Lulu Talk Radio across all social media except Facebook, where I am Mama, MOMA, Trician, last name Trician. I have a support group that we meet every Monday virtually for now. It is a group of moms at this point. We have a couple of dads, but they're too chicken to show their faces. So I just give a shout out to the moms. So we meet every Monday virtually. If you're a parent of a queer child and you'd like to join us, just say the word and we'll make it happen. Send me a DM, holla at me on social media, let me know who you are, and I'll make it happen. Let's send some more likes. See if we can get more people to come. But yes, so that's what I do for a living. I'll see you all next week. Hi, Rick James, Actual 69. I love that. Nice name. So I will be on my merry way because I have a live earlier on today on Instagram. So if you're on Instagram, please follow me. And follow me on Instagram and join me for the live. It's at 3 p.m. Central today. I'll be on Black Parenting Magazine. I'll be their guest. Okay? Alrighty, nighty. Bye. Bye, everyone.